Joining me now is Dr. Michael Rosenberg. He is a cardiologist with CU and Shoots. Dr. Rosenberg, it's so great to see you this morning.
Great to see you. Thanks for having me.
And we just passed, we were kind of jokingly saying, I was jokingly saying at least, that we just passed Heart Health Month. But really, doctor, it's March. Every month of the calendar is Heart Health Month.
Yeah, at least in my world, we tend to spend a lot of time thinking about that. So yeah, for
Yeah,
sure.
and heart disease, cardiovascular disease, high cholesterol, that is still the silent killer. It is still the number one disease when you look at the Center for Disease Control, right, doctor?
Yes, and it's also, a lot of it is preventable, which is I think where most of the motivation comes to try to find ways to improve health and reduce the risk of cardiac disease for sure.
Are there certain populations that, at least in your practice and CU Anschutz, that you've seen maybe that are unexpected in terms of having cardiovascular disease, having challenges with the heart?
Not so much in my world. I'm a subspecialty of cardiology, so I manage rhythm disorders. So like atrial fibrillation is probably the most common one, and relevant to what we'll talk about is probably the number one reason people come in with wearables or information from outside. So the majority of them, it's not surprising because most of them are older and age is the biggest risk factor. But we do see it in younger people and often actually have a diagnostic challenge of whether we believe that what a device told them they had is actually what they have. So
Yeah, and we're talking this morning about, not I guess, we're talking about how some of those devices can be analogous and help you as a practitioner. I'm not wearing a device this morning, but I do have one. I wear it on my wrist fairly regularly. It tracks my sleep, it tracks my pulse, some of my, I guess my heart rhythms. How how helpful is that to someone like yourself when you're trying to diagnose atrial fibrillation or some type of heart ailment?
sure, I think there's two parts to it. I think that when I tell a lot of patients, there's the monitor telling you that you have a rhythm, which is based on kind of a pulse measure. It's called a PPG monitor. It's not very accurate, and the companies don't claim it to be diagnostic in nature. It can be suggestive, but I tell a lot of people if your watch is telling you something, you should be skeptical, especially if you feel normal. Where we use them very effectively, I think, is the flip side, where someone's having symptoms and it's tough to capture. Certainly in the electrical world, we need to get an EKG or some kind of electrical signal of what's happening with the heart electrically to see if what they're feeling is actually an arrhythmia. And that's where watches that can actually produce the signal. And in fact, there's wearables and there's also just at home kind of EKG devices. And those can be extremely useful, and in particular for people that don't have symptoms that often. And so, there's patches and there's even implanted devices you can use to detect these. But it's been kind of a game changer in terms of being able to make these diagnoses without a huge, invasive burden. And there I have been surprised. In fact, we've had people where we thought they had some condition and then they finally got a signal from their watch and it's something totally different. But there, it's not the watch telling us; it's them getting the signal from that, and then we can look at it in the clinic and make a diagnosis.
Do they bring like a trunk load of data or give you access to it? I'm just curious. I mean, how do you? That's a lot to parse through, even if you have some type of artificial intelligence tool. Obviously you're trained as a physician to look at these things, but I would imagine that some patients can be kind of overboard and be like, I have 50 spreadsheets filled
Yeah,
with data over the last 365 days.
there are those patients, yes, who want to show those patients didn't need wearables for that. They often would come in before with their home blood pressure measurements and everything, and want you to look at their charts and things. But yeah, most of the new devices now are pretty user friendly in that sense.
Mhm.
They can get a report that's a PDF that they, a lot of even people I wouldn't have necessarily thought of as incredibly tech savvy can come in with something on their phone that showed what their heart was doing when they had the symptoms. We actually have a system in our healthcare system where they can transmit it through the electronic health record to us, and then we can view them. So if they're home, they send us a message with a picture of what the heart was doing, as recorded by the device, and then we can see. So yeah, it can be extremely helpful. But yeah, that's not the reams of information, and certainly a lot of the I would call it entertainment-based commercial sort of stress monitors and a lot of that type of data is not super useful, even though people do sometimes bring it in.
But I think what it's done is it creates a lot of awareness. And so maybe someone who is younger, I always think about, yes, older people like myself probably start to get a breakdown in some of their, cardiovascular system over time. But the younger folks that are wearing the watches, the wearables, they're they're in tune with it, and it actually could help with future cases or preventing future cases of
I,
cardiovascular disease, I would imagine.
yeah, I think so. I think it's the way I would kind of equate for a lot of those patients. It's sort of like if you have a diet log where you have to start writing down what you eat, and you know, once someone's doing that, they're just more likely to eat more healthy because they have to write down and see what they're eating. And so, in the same way, if you have a activity monitor that's showing you how active you were during the week, you're more likely to want to have higher steps. And so I do think it can be motivational, not for everyone. I mean, in some people it can add stress, in particular if it's telling them things that we don't think they actually have. But certainly, yeah, as a way to just raise general health awareness, I do think it could be very valuable in that regard.
And these devices, I guess, are about the Apple Watch in particular is probably about 10 years oldish. We've made great technology progress. I would imagine, you probably talk to a lot of technology folks. I mean, there's an infusion between technology and medicine. We're going to see even better smart wearables over time. I mean, we're probably just at the very cusp of where this will eventually go.
I think so. There's some interesting dynamics there that I think are challenging. The main one being what's considered medical grade versus sort of just commercial, entertainment we think of. So the Apple Watch, in a way, it's not medical grade. You can't, prescribe an Apple Watch to make a diagnosis. The way there are monitors where you actually can do that. That space is being narrowed. I do think. I mean, I've done 10 plus years of research on wearables. And I will say that the motivation for me has always been, if you think about how do we find out that blood pressure was important for heart disease, it's because people could come into the clinic and you could measure their blood pressure. But I always said that you're getting a sample of like one day out of the year of this measure. Whereas if you had a way to collect information about what they're doing, on day-to-day basis, you probably could find a lot more factors that can predict heart disease, and that can be modifiable as well.
Yeah, well, certainly, I think it's great. Obviously, it's not physician grade or medical grade, but I think hopefully we'll get there. Maybe there'll be at some point implants where you just stick it into your body, or the doctor sticks it into your body, and you're reading data 24 hours a day, 7 days a week. I guess we'll have to. Maybe some privacy issues there. But
As I say, we have those already. It's just it turns out, and again, I actually thought that that people might want that because there's a monitor you can plant under your skin that records your heart continuously. In my mind, it would have been nice because then you don't have to charge it the way you do your watch every night and stuff like that. It turns out people are super excited about implanting things in their body if they don't need to. So, but potentially for sure, yeah.
Yeah, well, it's certainly exciting, and it helps people like you make the best clinical medical decisions on behalf of patients. Doctor, we really appreciate you joining us. Thanks for all the great research you're doing. Thanks for joining us, and we look forward to having you back on the program again very soon, sir.
Yeah, absolutely. Thanks for talking.
Well, thanks for watching, and don't forget, we're back again tomorrow morning with another great expert and another great topic. You can tune in right here Monday through Sunday at 7:30 a.m. Eastern Time. And don't forget to subscribe to our daily newsletter, The Morning Pulse, for all the news in one place, delivered directly to your email box. Check it out at our website.